Okay, we're back. We're on to, in this series, let's see. I encourage you in the first video to keep going. In the second video, I said what not to say. So if you're kind of coming to this video first without seeing those other two, you can kind of stop here, go back and see what I said about what not to say. And I'm just encouraging you in the first video. So this is video number 3. And in this one, let me see, look at my phone. I'm going to be dealing with what is bothering you today. How can I help you? Both of those questions have 5 words in it. And the number 5 is a great number. It's the number of grace. If you don't understand what that means, you know, you can China YouTube Pastor Joseph Prince. He'll explain all that. That's not what this video is about. But 5 is a great number, like the number 5. And so we're talking about what to say when we step into the room with the patient, standardized patient. We've knocked. And they say, come in. And you walk in. Now, this is after you've filled out your blue sheet. I know this is a white sheet. I know. But you filled out your sheet. You've divided it in 4. I'm going to do a video on that after. Okay, so because that's like a practice one. So don't worry about that. We'll fill out the sheet. Or you can go to my other video. I had a video on blue sheet. But this one we're really going to practice. So you filled out your sheet. You've gone inside. And I'm going to create a scenario. Now, is this a patient that I saw when I did the CS? You know I can't do that. So please nobody ask me about what I saw. Oh, give me an idea. You know, I'm not. No. They say, please do not share what you experienced at the exam. And I'm not going to do that. I'm giving you a scenario out of Step 2 CS. Or actually, I'm going to give you a patient that I had in clinicals when I was back at home in Barbados. So let's use that so that we go in. Now, let's just say they say SPs prepare, doctors prepare, whatever, you know, time is up. You slide it across. Now, this is a good one. Your patient, should you choose to accept this mission, all of you sitting down there in front of me, you have your sheet. Your patient is a 65-year-old man. And they may or may not say he's a widow. I don't know if they'll let you get that much information. Let's just say he's a 65-year-old man and his complaint is a pain in his leg. That's all. They give you the vitals and everything like that. You fill out your blue sheet. He's a 65-year-old man and he's got pain in his leg. So even in that first minute, in your differential, you go, pain in the leg. I wonder if it can be DVT, trauma. You know, you're like, gosh, I don't know, pain in his leg. DVT, trauma. I don't know what else it could be, you think. Or you say arthritis, because you can never tell people, patients say leg, but they mean joint. So you go in with a differential, which is kind of, you're not really sure what it is. So you go in. Now, if you don't ask, what is bothering you today? Or, how may I help you? Let's just say we go in and we stick with these mnemonics, which we love. Mnemonics are great. Don't get me wrong. Mnemonics are awesome for keeping you on track. I talk a lot about a mnemonic. Please don't forget, however, that you are a doctor first. And we tend to flow when we take a history. The mnemonic is to guide you so that you don't forget, but I want you to flow. And I'm going to share with you what I mean when I say that. So you go in and you see that it says 65-year-old man, pain in his leg. So if you go in, my name is Dr. Durant, and so on, so on, so on, and you know, you're thinking pain, I got to do pneumonia, so I got to start with liquor. I see that you've come in complaining of pain. I actually should have dealt with this and what not to say. Please do not assume that what is on the sheet is the complaint. So I'm getting ahead of myself. But let's just say you started off with that. And I see you've come because you've got pain in your leg. And the patient will then say, yes. And then you say, can you tell me more about the pain? Where is the pain? And he says, well, it's in my leg. It's in my left leg. I know you do the thing. You do the drill. Like quora, intensity, quality, onset, progression, duration, and all of that. All good. All good. No worries. Then you say radiating. If it radiates, you talk about relieving factors, aggravating factors, associated symptoms. Please don't use the word associated symptoms. The patients have no clue what you're talking about. If you want to talk about anything associated, you break it down. So you've dealt with all the pain. He says it's in his leg. He even goes so far as to tell you, I've been walking, I've been exercising, but I find that as the more I exercise, the pain gets worse, and it's relieved when I rest. And you're like, woohoo! Yay! This is intermittent claudication. Yay! Yeah. So you're going intermittent claudication. All right. Then you go over to review of systems. No, he doesn't have any fever. He doesn't have any headache. You go through the review of systems, and the only thing significant that you've got is pain in his leg, gets worse when he walks, relieved when he rests, and so you've got it in the bag. You have pretty much figured out what this encounter is all about, right? So you get to past medical history now, and you go, have you ever had this before, and stuff like that. He's like, no, I never had this before. It's only really been bothering me for the last 3 months. Only been bothering you for the last 3 months. Remember, he's a man, right? He's a man, right? We who are doctors know when a man comes, he's got an issue, right? He's got an issue. What? He's come with pain in his leg. Is he exercising? All right. He's 65 years old. Okay. So then you go on, you do PAM, hug, spa, surgical history, blah, 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 blah. Turns out he's a widow. He may say to you, if you ask, he's a widow and stuff like that. You'll get to the end, weight loss, blah, blah, blah. No. So you've got to the end. You examine the leg, you check for pulses, you check to see if it's red, warm, swollen, because you want to rule out DVT and everything like that. No, everything's negative. So you think, okay, Mr. Brown, I'm thinking that you got something which is called peripheral artery disease, but you break it down, I think that there's some narrowing, and what's happening is that your leg is not getting as much blood supply as it needs, and when you exercise, that makes it a little bit worse, and so on. So you explain what he's got, and so on. And you may even go so far as to say, well, is there anything else that you can let me know, anything that I can help you with, or whatever. He may or may not open. Because let me tell you what has happened here. For many of us, we have missed the point of the encounter. You go, I do not get this. I do not get this at all. Okay, let me explain. If we or you had come into the room, no, hi, Mr. Brown. My name is Dr. Duran. I'll be your doctor looking after you today. Nice to meet you. Do you mind if I write and sit while we chat? Okay. Get the permission, you sit. If you had opened, rather than saying, I see you came in with pain in your leg, which means he has to go with you, because you said pain in his leg, he's gone. Pain in his leg, all right, I'll go with you. If you had, however, said, what is bothering you today? How may I help you? If you had done that, Mr. Brown may have said, well, doc, I know what I told the nurse outside. I know what they have in the paper. But really, I'm a widow. I'm 65 years old. My wife died 5 years ago, at which point you say, I'm sorry to hear that. He says, yeah. And just recently, 3 months ago, I got a new girlfriend. She's 35-year-old, 40-year-old young thing, and I've just not been able to, you remember Jerry Seinfeld? one of those early episodes when he and Elaine were trying to see if they could hook up again. That was so funny. And Elaine is decided to bed and she's with the magazine like, you know, turning the pages of the magazine. And Jerry's just sitting down there like, the little dude, you know, the little dude. The point of the encounter. The point of the encounter is erectile dysfunction. So you've walked out of there thinking, oh, wow, yeah. But you've failed the patient. You haven't found out what was bothering him. What brought him was not the pain in his leg. As far as I know, as how men go, his foot could fall off with peripheral arterial disease. It's the little dude he's worried about. So you haven't dealt with that. You haven't data gathered to the point where you have ascertained that that is the main thing that he's concerned about. He is concerned about the fact that I've got now a young hottie. We want to get it on. We've been seeing each other. Some action. We want to have some action going on. And nothing is happening. And nothing is happening because of the peripheral artery disease. So you are right. Peripheral artery disease is the issue. But that's not what's bothering him. What's bothering him is erectile dysfunction. You see what I mean? So if you had said, what is bothering you today, that opens the door for the patient to say to you, this is really what's bothering me. Then you can get around to the, peripheral vascular disease, which is manifested by the fact that when he exercises, he does get intermittent claudication. So that's understood. Don't get me wrong, that's all part of it. But that is a sign of the real problem. And that is the point of the encounter. And so my point to you is this. Every encounter has a point. Every encounter has a point. In other words, have you data gathered enough? Have you shown empathy? He talked about his wife. Have you shown any kind of sympathy that she has died and he's feeling it? Have you really gotten the point of the encounter, that it's not about the pain when he exercises, the pain in his leg when he exercises? Have you gone to the point, why is he really in front of you? And for us international medical graduates or foreign medical graduates, sometimes we stick so much and so closely to the mnemonic that we forget the whole point. The whole point of the encounter is a patient. The whole point of the encounter is, how can I help you? What is bothering you so much that you've taken time out from what you're doing to come to see me? And how can I help you with that problem? When you discover this and you get to the point where you realize that it's erectile dysfunction and you talk about what you want to do to help him, you're not going to, besides aspirin, of course, which you're going to talk about, you don't say that you're going to give him a phosphodiesterase inhibitor, which increases his cyclic AMP, which is going to reduce his calcium, which is going to cause smooth muscle relaxation as a result of vasodilation. That would give rise to, more blood coming into the penis. Now that sounds really great, and that just shows your knowledge of step 1. So you see, you get step 2 CS and step 1 all in this video. So you don't talk about that, because then you'll lose the encounter, you'll fail the encounter. What does a patient know about phosphodiesterase inhibitors? First, and also, you've just wasted too much time. You're going to give him something which is going to cause more blood flow that's coming to the penis. It's also going to help with his leg. It's like a secondary, trust me. But it's going to help more blood to travel in the vessels in his leg. And more importantly, we're going to get more blood flow going to the little dude. Well, don't call it a little dude. I'm just saying that between you and I. Okay. We're going to get more blood flow in critical areas so that we don't have a problem with that. You know what I'm saying? Right. So we don't mention the little dude. I'm just saying that you and I. Right. But the whole point of what is bothering you today, how can I help you, is you want to get to the crux of the matter. That way you can fine-tune your questions. Follow the mnemonic by all means. But when you ask that question, that opens the door for the patient to be able to tell you truly what is wrong. You may luck out and he may end past medical history when you talk about sex, if you even think about mentioning that, because you may not even think about asking that question because you have it in your mind, oh, peripheral arterial disease and pain in his leg, and you're scared too, you're scared like, oh, step 2 CS. But when you're there, just think about the patient. So let's say you did get wise up and you go, whoo, let me ask him about sex, and then he said, yeah, I've been having a problem in that area, doc. But wouldn't it have been great to have known what you're dealing with in the first few minutes when you walk through the door? You see what I mean? So it's all a tie-in. Every encounter has a point. Communicating with the patient, being able to be empathetic, and being able to get the real reason why they have come through the door. Can they understand what you said? Do they know how to treat or manage? Do you know how to treat or manage their condition? And do they get the impression that you know what you're doing and that you have confidence? So let's see if there's anything what is bothering you today. No, that's it. And I'm really hoping that this is helpful to you. Follow your mnemonics by all means, but keep the patient in mind. Find out what's bothering them, and try not to be scared. It's all good. You guys are going to do great. All right, so what's my next video? Well, my next video is the importance of the review of systems. This one is a really good one. I thought a lot about what I'm going to say for the importance of the review of systems. So stay tuned for the next video, and I'll see you soon.